Will soon collect settlement funds from several different drug companies after a lawsuit, and the money could be coming as soon as the end of this year. This is all about the companies that sold opioids, which led to addiction crisis in our state and really across the entire country.
News 19's Zoe Henry spoke with the local rehab center about the potential for these funds.
South Carolina will receive $360 million over the span of 18 years from a federal opioid settlement. State officials say the first installment is from Johnson & Johnson. The state should see that money in a couple of months. The funds can only be spent on measures addressing the opioid crisis in South Carolina.
It goes to providing psychosocial support for families, helping educate them about how drug abuse works, how addiction works, and what they can do to help their family member combat that.
DHEC Director Dr. Edward Simmer helped develop the settlement guidelines. He says it's important to prioritize providing Narcan and fentanyl strips to everyone in the state for preventative measures. He also adds it's important to provide support to families of those with addiction.
What are the treatment resources? So a lot of education for families, providing them with resources, and also helping families who can't afford treatment to find affordable treatment options for their family members. It'll include all of that.
This money is not guaranteed to all treatment centers. There will be an application process and a list of guidelines to be accepted. Robbie Robertson with Lorraine Act, an agency which helps treat addiction, says if it were to receive money, it could broaden the scope of its program.
Well, organizations like ours depend on money from government sources, and so we're always looking for additional funding as the need increases. So this settlement is like a landmark case. It's incredible that this amount of money is coming back into South Carolina to fight this incredible problem.
Sarah Goldsby with Deotis says there will be a reassessment as the need arises.
It's too early to determine if this will be enough, especially knowing that the funding will come in incrementally over many years. And so we know that more resources will be needed.
Dr. Simmer says the focus of program improvement will be helping prevent more overdoses in the state. In Columbia, Zoe Henry, News 19, WLTX.
A 9-member panel will be appointed to help oversee the spending of that money to make sure it goes to the correct places.